Well, this is the first variant of concern that's got scientists interested since the emergence of the Delta variant. We heard at that press conference last night Professor Chris Whitty saying that that was still the Delta variant, still making up the majority of cases here. But of course, overnight genomic sequencing unveiled that there are 2 new cases in the UK, one in Essex, here in Brentwood, and further north in Nottingham. The Health Secretary Sajid Javid says those 2 cases are linked, connected, and they are also connected with international travel coming from southern Africa. That is where this variant was first discovered. Contact tracing testing is underway to try to find out any contacts of those with those cases, and targeted testing is being undertaken in areas where those people are thought to have been infectious, and all of those cases will have genomic sequencing undertaken as well. Now, at that Downing Street press conference, Professor Chris Whitty, England's chief medical officer, said this Omicron variant has extensive mutations. We heard just now in that clip from the Prime Minister, and he said it has radically different spike proteins. And the reason that this is concerning is because those are what the vaccines target. He did go on to say there's reasonable chance there will be some form of vaccine escape with this variant. Now, the World Health Organization is saying, please don't panic. We are still, of course, looking into the data behind this. It will take some weeks for scientists to uncover the possible increased transmissibility of this variant. But it does have over 30 different mutations, and that's double what this Delta variant has. The CMO, though, says that vaccines could still be sufficient in stopping people getting seriously ill. So there is an urge, words of caution this morning not to panic too much. But of course, there is concern. Now, what restrictions are being brought in? Well, the PM says that people will not be stopped from travelling altogether, but all international arrivals must self-isolate and have a PCR test on day 2. If that comes back positive, they will then have to continue to self-isolate, and all close contacts of positive Omicron cases will then have to self-isolate for 10 days, regardless of if they have been fully vaccinated or received a booster. Furthermore, it goes on, mandatory mask wearing is expected to be brought in, or will be brought in, from next week. We're going to hear more from the Health Secretary in the coming days or so. That will be reviewed in 3 weeks. That'll be in shops and on public transport, not in pubs and restaurants, though it's worth noting. And also, they are going to boost the booster campaign. The Health Secretary, Sajid Javid, has asked the JVCI to consider giving boosters to more people and reducing the gap between the second and third dose. Experts are also going to consider whether to extend booster jabs to all under 18s. But what does this mean for international travel? Well, we had changes to the red list. 6 southern African countries were added on Thursday night. 4 more have now been added. That's come into effect at 4 a.m. this morning. They are Angola, Malawi, Mozambique and Zambia. That brings the total on this red list to 10. They join South Africa, Botswana, Lesotho, Eswatini, Zimbabwe and Namibia on that list.